So in this video, we're going to do a client consultation. We have Ella here, who is a newer esthetician, and we have Leah here, who's also going to be, are you licensed yet?
Yes, I am.
Okay, congratulations. So two newer estheticians who are still learning the art of the consultation. So today we're going to do an acne consultation, and this is training. So we are just training Ella, we're training Leah, and Leah has some acne that we're going to be addressing today. Now, we do offer an acne coaching program, but we're not necessarily going to discuss through the consultation our acne program. And the reason why is because looking at Leah, her acne is actually very mild. So we're going to do a consultation with somebody with very mild acne who doesn't necessarily need an acne coaching program, but we're going to get into it because you never know what's going to happen once you start this process. So Ella is going to ask her some questions, and I am going to be here to guide and to coach both of these young ladies in how to do a consultation. Take it away, Ella.
So what are some of your skin concerns right now? I see you are dealing with some acne scarring.
Yeah, basically I'll get like some acne with it's got a lot of oil in it, and then it won't go away unless I pop it, and then it scabs over, and then it scars for a really long time.
I see. And are you doing anything to like prevent yourself from picking at those areas? Do you feel like it makes it worse, or do you see a difference like when you leave them alone? How long do they stay on your face?
They honestly kind of stay on there until I start picking at it.
Does it become more inflamed and irritated afterwards?
Yes.
Okay.
It's awkward asking questions, especially when we're on camera. If you want me to jump in at any time.
You can jump in.
Okay, she's like, okay, let's jump in. So you asked the question, trying to remember exactly what you said. Like, you said acne scars. Let me read her thing. Okay, so she said acne scars, but her treatment goals also say less acne, which is telling me, and you did say that you still are getting breakouts. So we need to address the breakouts almost before the scarring. So I like to call this triage. So in the hospital world, you're going to triage people or a person based on what really needs to be fixed first. Like the person with the gunshot wound or the swollen toe in the emergency room. The person with the gunshot wound needs to be seen first. So we want to address the underlying conditions of the acne first. We want to bring your active acne breakouts down before we necessarily want to take care of the scarring. In acne treatments, a lot of times both will happen at the same time,
right,
which is really amazing about what we do here. So, do you have some makeup on right now?
I have a little concealer on.
She's got a little concealer on, so I can tell that she has some makeup on. So, just looking at her, I see more like just pigmentation. I can't tell from here to there if it's actual active acne or if it's scarring. So part of the consultation is getting them on the table and actually cleansing their skin and looking at your skin and seeing what's going on. Leah also said that she has like oil inside her pores. So I want to learn a little bit more about that. What I am seeing is cystic acne, mild cystic acne, which is the swollen red acne breakouts. So when you pop your pimples, you're getting like a lot of oil out?
Yeah, it always the oil comes out first, and then sometimes pus will pop out, but it's mainly just oil.
So you're getting like clear oil,
yeah,
clear things
oil
coming out. Okay. So we're gonna tell her that picking is bad. But we don't like to say it like picking is bad. Don't do it, Leah. We don't want to do that to our clients. It's not nice. We don't want to pick on them, even though they're picking their own face. So part of our, I'm I'm just going to continue the consultation. So normally when we're working with people with acne, we put them on an acne clearing program where we see people about every 2 weeks, and you're going to go home with home care products. We're going to revisit and see what's going on every 2 weeks. I don't know if you need that yet because you don't look that severe. She did express that she's very oily, so sometimes just a simple benzoyl peroxide may actually help decrease that oil and make your skin feel a little bit better. What's that?
Even sometimes during the day, like you said, you can help too.
Yeah, so we have a very specific way of how we want you to use benzoyl peroxide. When we sell our benzoyl peroxide products, we always put them on the protocols first. So we have a sheet for that where we can teach you how to actually use benzoyl peroxide in a way that your skin's going to slowly adapt to it, where it shouldn't overly irritate your skin, dry you out, and make you feel uncomfortable. But I don't know what you need yet until we actually take a look at your skin. Are you okay with us doing a cleanse and taking a look at your skin and seeing and doing a full skin analysis?
Yes.
Okay, awesome. So what we're going to do is we're going to get Leah on the table, and we're actually going to continue the consultation while she's on the treatment room table, so we can really make a true assessment, because we just can't do it until we really see with our magnifying lenses and glasses and under the light what she wants. Usually when somebody comes in here for acne, I will say, I see you're on all these other products. If you want to really get your skin clear, I can't get you clear if you're using other products that I don't know what the ingredients are. Are you okay with completely switching over to different products?
Yeah.
Okay, awesome. When we're working with acne, we need that commitment.
Mm-hmm.
So like if you're another esthetician watching this video and you have your own line of products that you may be using, you're gonna know those products. You're not gonna know the 10 other products that they're using from other companies.
Right.
And I can't control, like, I don't know if those moisturizers have oils in it. I don't know if they have aggravating ingredients to them, full of essential oils that may be irritating, or fragrances that can be irritating to acne. Also, when we're doing a normal acne consultation, we will talk about dietary stuff. But with your skin, Leah, you're just very mild, and we just want to put you on some simple products, 3 or 4 products in the morning, 3 or 4 products at night, that's it. And make it as simple as possible for you to achieve the goals that you're looking for. So we're going to talk about your active acne, and we're also going to talk about your scarring. The products that we can get you on will also help with your scarring. It'll start decreasing that pigmentation as well. So I want to see if she has non-inflamed acne under that inflamed acne. Because before we started this consultation, she was about to purchase a vitamin C serum that has vitamin E in it, and getting somebody on that who has non-inflamed acne is a 50-50 chance that it might make you break out. Mm-hmm. So that's a conversation you can have at checkout, and also letting them know about our return policy. So we have a great return policy in our business that we want to make sure that you're completely satisfied. So any products that you go home with, if you have any issues, reactions, sensitivities, or allergies, absolutely bring them back. Sometimes you may not know what that product is until we talk and dig deep. And sometimes we have to do process of elimination. Like, okay, let's get you off this one product for a couple days, see how your skin responds. And it doesn't mean you're allergic to it. It might mean it's too strong for you. You might be using it too much. So that's part of knowing our skincare products and how they work with the skin, and why we need to get our clients back in frequently, especially if they're suffering from acne. Okay, was that enough information for you both ladies?
Yes.
All right, you ready to get on the table, Leah?
Yeah.
Okay, let's go ahead and take a look at your skin. Normally, I like to have my light on away from their face, so they can start getting adapted to the bright light that's about to go over their face. I know it's just a little detail, but to knock things over, but to be a 5-star esthetician, don't knock over your lights. I like to really make sure my client is super comfortable when they're working with me, comfortable with me personally, in the treatment room, on the table, comfortable with the lights, the whole thing. This light is very, very bright. So sometimes what I'll do is I'll just start bringing it closer to their face so they can start getting used to it. And I'm already watching her. She's already closing her eyes. So I may ask her the question, is that light pretty bright near your eyes right now?
Yeah.
Yeah, you're feeling it? Okay.
Yeah.
So I'm not just going to put this light like right over their face. Now it is dimmable. So I'm going to put it on the lowest setting possible, and we can always adjust it as needed. Every person needs different. You're a lot younger than me, so you probably see a lot better than I do. I like the bright light. So you can go ahead and put the head wrap on her. So she's just going to, she's already got her gloves on, which is a, what do they call it, personal safety device?
Yeah, something like that.
I'm a little old school. I went to aesthetic school in the mid-2000s, and we didn't wear gloves at this part in our facial. I have no problem if somebody wants to wear gloves. When we're working with acne, wearing gloves is pretty important because we are dealing with bacteria. I mean, everybody has bacteria on their bodies. It's just part of our skin physiology. But unfortunately, people with acne will also have blood coming out too. So we need to be super mindful of that. You need to cleanse her first. So you don't actually have to put the light over her face yet. But she's going to take off her makeup so she can get a better, closer look at her skin. You forgot the water. That's okay. I can help you out here. So one thing that you can do is you can, I'm just going to come over here. So we have like a little water thing right here. You can literally just put it in your hand. Woo! Yeah, that works. Other hands. We have a water cooler in this room, so we always have access to fresh running water without a sink in this room. So if somebody comes in for a facial and they have makeup on, sometimes I do a single cleanse, sometimes I do a double cleanse. It depends how much makeup they have on. So Leah, you don't have a whole lot of makeup on, right? Just some concealer.
Just some concealer.
So she just has like one layer. She doesn't have full face of like MAC, which is like really heavy duty makeup, I think. Do they make light makeup too? I don't know.
Yeah.
Do they? Okay.
Like tints and stuff.
Yeah, I don't wear a lot of makeup. I actually want people to see my skin. So, and I'm proud of my skin. Oh, my cup of coffee. Just grabbing a towel there. What's that? Yeah. You don't want to put super hot towels on somebody for the most part. Some people love a really hot towel. So she checked the towel on the inside of her arm to test the temperature to make sure it's comfortable before she puts it on her face. So that's one of the protocols that we do at our spa. Now, Leah doesn't have any eyelash extensions on, so she does have the towel over her eyes. And we did some training earlier today, and the woman did have eyelash extensions on, and Ella was very considerate and didn't smash her eyelash extensions with the hot towel. I'm like, I'm gonna put it on. Can somebody get a facial with eyelash extensions? Absolutely they can. You can eliminate the steam, or you can cover their eyes. You can put a 4x4 twisted over their eyes so it prevents them from their eyelashes getting moist. You can also put goggles on for somebody who has eyelash extensions. So absolutely somebody can get a facial with eyelash extensions. There's a lot of estheticians these days who aren't using steam. I still use it a little bit. It's not my go-to. I do a lot of advanced facials. So I don't use a lot of steam, but I personally like steam on my face sometimes. So she's going to apply a toner. Our toner does have a little glycolic acid in it. which can tingle on some people with sensitive skin. She did say she has sensitive skin on her intake form. So feel free to use it on her face, test it out, see how she likes it. Using toner is going to be really good for her right now because if she does have any residual makeup on, she's getting it off so she can do a better consultation and skin analysis.
Was that tingly at all?
Just a little bit.
Okay, so she is a little tingly, so that's really important to know. A lot of people don't feel anything from that. I feel tingly from a toner as well. Yeah, and some people can react to the toner in their home care routine, so that's something to be mindful too. It is a nice little boost. Some people absolutely love it. Some people it just doesn't work for. That's just how skincare works. So now she's all cleansed up. You do have glowing skin. So did you notice when she was sitting during the consultation how glowy her skin is? At her age, to see somebody that glowy is telling me she's naturally very oily. And she's still glowing right now. I can also tell that she doesn't have a lot of lines on her face right now. And she's still very shiny even just from here. And she also talked about how she has a lot of oil coming out of her inflamed acne breakouts. So now you're gonna do a skin analysis. So what are you gonna do, Ella?
Touch your skin.
You need the light.
Under
Yep.
the light.
So, yep. Oh, tell her you're bringing the light over and have her close her eyes
I'm
first.
bringing the light over. Close your eyes. Too late.
Yeah, too late. This is training. This is why we're here. So, I would put glasses on. So there's some magnifying glasses over there. So we don't have a mag lamp at our spa. We don't have one in any of our treatment rooms here. So there's glasses right there in the little blue thing with the sticks.
Oh my god,
yeah.
right.
It's just right in front of them. So we prefer a light, and then we wear pretty much readers, cheaters as some people call them, to do a skin analysis. Now, if we're gonna do extractions, we have to like kind of lean back a little bit in case if anything wants to pop up on our face. Oh, is it broken? I have different magnifiers. Our skin analysis. We do have multiple forms. So I've got 2 pairs of readers here. These ones are really, really strong. Now, if you're a young esthetician, like in your 20s or teens, you may not need the crazy strong ones. But let's see what you actually see. Now, mag lamps are what, 2%, 2.5 times magnification. I think these are like 2 or 2.5. So these are comparable to an actual mag lamp. So what are you seeing, Ella?
Seeing some pores, mainly towards like the centers of her face.
Okay.
So like the T-zone. And then I'm also seeing some non-inflamed acne in the forehead region as well as over on the kind of the center of the cheeks.
Make sure you're talking loud enough that the camera
sorry.
can hear you.
Sorry.
It's okay.
Talk really quiet. I'm seeing mainly the congestion towards the center of the face, but I still am seeing some of those non-inflamed guys kind of scattered along her cheeks as well.
Okay.
But mainly gathered in the center. And then the bigger angry ones are more so on the cheeks. The inflamed acne.
The inflamed acne. The angry ones. Okay. I'm going to do a skin analysis now. So we're going to switch seats.
Go ahead.
When we're doing a skin analysis, there's a lot to look at. And always being mindful of what they're looking to achieve. She was specifically talking about reducing acne and her scars. So at quick glance, I actually see numerous, a couple different kinds of scars on her. I'm going to put my glasses on because I'm old. I need to see. In fact, I'm going to turn this light up. Is that okay with you, Leah?
Yeah.
I'm going to turn up once. Is that okay?
Yeah.
I'm going to turn up one more time. Is that okay?
Mm-hmm.
Okay. I could see her eyes twitching just a little bit, but she wasn't like wincing. So I could tell that she still looks comfortable. Is that comfortable on you?
Yep.
Okay. Yep, so you had a breakout recently right here. definitely have some cystic acne. You have a lot of pores on your face that are clogged, but they're not like acneic pores. So when you're talking about her T-zone, that's not what she was complaining about. She's talking about her actual acne. So what we learn in aesthetics school is, oh, our clogged pores. But acne is so much greater than just clogged pores. Yes, I'm sure she might want to have a reduction in the pores. So I'm gonna ask her about that. Okay, so I know we're gonna talk about the acne. How do you feel about all your pores and stuff?
I mean, they're just there. I mean, I'd like to have them cleared, but it just probably is not gonna happen.
Okay, that's not your number one concern right now, right?
Yeah.
Okay. Now, if her clogged pores were like really large, enlarged with the non-inflamed open comedones, which is like the deep blackheads where you really get them out, that's acne. So clogged pores is not necessarily acne. So yes, it's something that, can happen with facials. We can probably get you cleaned out. Maybe some salicylic acid in your home care routine will naturally start lifting some of that. But that's not what we're working on treating today. So, but you do actually have some of those open comedones in the T-zone, well, in the forehead anyway. I'm just gonna see if I see any of the non-inflamed acne in here. I don't. I definitely see the clogged pores, and I see it looks like filaments and little hairs on them. Yeah, so they actually come out pretty easily. This is like an esthetician's dream right now. But that is not her main concern. Her main concern is the scarring. So I'm noticing you're getting a lot on the right side of your face. Do you sleep on the right side of your face?
No, actually, I sleep on the left side.
Do you sleep on the left side? Okay. It looks like you still have a couple active breakouts. You've got like a whitehead on top of the inflamed, swollen acne. I would call this very mild acne. I don't think you need to be on an acne program. I really don't. I don't feel like your acne is that bad. I think coming in for some facials, so we can definitely do some follow-up and do some extractions and get some of this stuff out. Now, as I bring the headband back, I do notice she has a couple breakouts up here. Now, something we actually discussed earlier this morning is that when you are doing a facial on somebody, I personally like to have the headband back where I can see all the skin. It does expose some of the hair. So if your client is getting a lunchtime facial and they want to go back to work, you may not want to get things in their hair. But for when I'm working with somebody with corrective skincare, with acne or scarring or pigmentation, I want to see all up in this area. Look how much real estate is here. She has a lot of space up here that was covered, and you can actually see the line. So we had almost a whole inch. Yeah, it's like a whole inch of space that we weren't able to analyze because her headband was actually covering part of her skin. So being able to pull that back. And you also want to check their ears. So there we go. So I like to adjust that. So her ears were actually bent up. So whenever I put a head wrap on, I always check the ears. And I say, is that comfortable? Okay.
Yes.
Was that comfortable before? Did you notice your ears were even folded back?
I mean, slightly.
Okay. So she noticed it, but she didn't say anything.
It wasn't too bothersome.
Yeah, it bothers a lot of people. I'm telling you, I will wrap a head wrap on people and they're immediately adjusting their ears. And I'm like, give me a second. Let me get to it. I'll take care of it for you. But it's so uncomfortable for them that they're immediately changing it. So I do actually see that, you probably produce a lot of oil throughout the day, but you actually look a little dry right now. Does your skin feel dry?
Yes.
Yeah. I can tell that it's dry because see what's going on with this breakout right here? So she's got a little acne scar right here, and it's starting to form like little lines all around it. And that's just dehydration in the skin. So, I don't know what she's been using at home because I don't know the products, but we need to create balance in her skin so she's not drying out. So remember how I said earlier, getting her on a benzoyl peroxide may balance out her skin. Now I'm looking at it and touching it, I'm like, wait a second. She still could probably use some BPO, but she's gonna need some hydration to go with it. Now, I'm mostly seeing, you do have a combination of non-inflamed and inflamed acne. I think you might respond really well to some water-based products like gels, or something with a little jojoba oil in it. I wouldn't put her on any heavy-duty creams. She does have a lot of shine in her nose. I feel like her body wants to produce oil, but yet can still be dry at the same time. Why is her skin like this? I don't know. Maybe overexfoliation. Maybe under. Do you like to exfoliate your skin?
I do.
Yeah, okay. How often do you exfoliate your skin?
Like every day.
Okay. Can you stop that?
Yeah.
Okay. I'm very pro exfoliation, but every day. How are you exfoliating your skin every day?
I have this powder exfoliant that has salicylic acid in it that I put on in the shower. Usually it's every other day, but sometimes I will do every day.
Okay. So you're just exfoliating with a cleanser, with a powdered cleanser.
Yeah.
Okay. So you're probably getting a mechanical and chemical exfoliation. Okay. I think maybe the cleanser might be okay for her. Once again, I don't know the brand, but I have used on my own skin powder exfoliation, and I loved them. Okay, like this was old school, like 20 years ago. I thought it was amazing. My skin loved it. I was producing a lot of acne, a lot of oil, and I wanted my skin to dry out a little bit. But that may be a little too much for her skin. It's something that, it's not our product. I can't coach somebody when they're not on our products. But I know how those products work, so I might keep her on it. But generally, we already had the conversation about her completely switching products. Because I can't control necessarily products that we don't know the ingredients in. That is just how I work as an esthetician now. I don't want to spend time studying the 80 million other brands of skincare products out on the market. It's fun to know that, but I know our products. If you're another esthetician, you're retailing your own products, you know your products. You should know your products and learn them if you don't know them. So I would say she's a good candidate for a deep pore cleansing facial. So we have a facial on our menu that's not necessarily an acne facial, but it's one where we're just going to do extractions. It's pretty much an extraction facial. We're going to do a light enzyme, light exfoliation, extraction. But while we're performing a facial, we're going to talk to you about your home care. So because she does have active breakouts, non-inflamed and inflamed, but very few, I think, honestly, getting her on a cleanser, sunscreen in the morning, for sure. In the evening, cleanser, benzoyl peroxide, which we have protocols for, and moisturizer in the evening as a starting point. So do you love having a simple routine, or do you like using like 80 products?
A simple routine, definitely.
She wants a simple routine. Okay. Some people like to use a lot of products. Some people want a simple routine. Now, Leah expressed that she was interested in some vitamin C because she's heard, what have you heard about vitamin C?
Oh, I've used it before, and
Okay.
it like really cleared my skin, and I felt really good in my skin like when I was using it.
Okay. Do you know if that vitamin C had ferulic acid in it or vitamin E in it?
I do not know.
Okay. So our vitamin C has both ferulic acid and vitamin E. Vitamin E can make some people break out. I don't know if oils are making you break out yet. I can send her home with a sample, or I can sell it to her. We have a great return policy. I think hydration-wise, it would be lovely for her skin. I really do. A very simple routine for you in the morning would be, a light exfoliating cleanser. We have our Alpha Beta cleanser. We also have our Hydro Bright. We have a Hydro Bright cleanser, and then we also have a Mandelic acid cleanser. Now, Leah works here for us, And so we can see her every day where we can coach her skin a little bit better. And I want to be very conscientious of her budget as well. So I'm going to allow her to keep using her cleanser. Maybe. I have to ask one more question. You said you might be using this cleanser like every other day, right?
Yeah.
What are you using otherwise to wash your face?
So first I start with like a hydrating gentle cleanser from like La Roche-Posay, and then I go in with the powder exfoliant.
But what are you doing on the days you're not using the powdered exfoliant to wash your face?
I just use the regular cleanser.
So you're using like a creamy cleanser?
Yeah, it's like kind of creamy. It's like sometimes it'll burn even though it's supposed to be like gentle.
Okay. I burn from some creamy cleansers too. Yeah, sensitive skin. So we're dealing with somebody with sensitive skin. So I'm pretty sure Alpha Beta Cleanser is very good for people with sensitive skin. A lot of people don't have reactions to it. Have you ever used mandelic acid before on your skin?
No.
Okay. So we have a glycolic and salicylic cleanser. We have a creamy cleanser. I'm not selling her the creamy cleanser because she'll probably burn from it. And we also have the mandelic cleanser, which is really good for some gentle skin. However, some people do react to mandelic cleanser. I would say our mandelic is more gentle than the alpha beta as long as they don't have a reaction to it. Know your ingredients and know your products. So I need to make the decision of what's going to be the best product for her while she's using that. See, those are also, our cleansers are exfoliating cleansers. So
There's salicylic, isn't there salicylic in the alpha beta?
yes.
So that might be a good replacement for her microfoliant because it has the beads, which would still be.
Yeah, she may still
So
feel
I
like,
honestly,
yeah.
maybe the alpha beta.
so
Best of both worlds.
I think that's a fine choice. I don't think there's a wrong choice until we figure out how she's reacting. So you can always send somebody home with a sample. If you're not sure, as an esthetician, like when I first started, I sent home a lot of samples to people because I wasn't fully sure how their skin was going to react. Our alpha beta cleanser actually has anti-inflammatory ingredients in it that can calm a lot of people's skin. And so does our Hydro Bright cleanser. They both have calming ingredients while they're exfoliating the skin. We do have a 2-ounce bottle, so we could always sell them a 2-ounce bottle. But you know, we have a great return policy. And if she's willing to come back, like if she was a customer, willing to come back in 2 weeks and reschedule, she can always bring products back that aren't working. If you don't want a high return rate and you don't know your product's really great, I would sample it out. But in her case, I'm just gonna sell it to her because I'd feel confident in saying, like, we're just gonna switch you to the alpha beta cleanser. I wouldn't call it a hydrating cleanser by any means. In fact, I don't think creamy cleansers are hydrating. It's a cleanser. We're supposed to strip the skin of the oil and debris. And a creamy cleanser, an oil-based cleanser, is really going to start that removal process of products on the skin. She expressed interest in the vitamin C serum, and it's our most expensive serum. I'm happy to sell it to you. I actually think that will be a good product for your skin. And then sunscreen. We have a sunscreen. We have 2 sunscreen options here, an oil-free one and one with oil. I'm actually thinking, do you like it when your skin looks a little dewy?
I mean, I don't mind.
She doesn't mind. Okay. When I was your age, oh my gosh, I was a hot mess. Like, I was like sweating profusely, oil just out of my pores. And I had like the rice paper to blot my face like throughout the day, especially if I had like an event to go to because I was so oily. But it helps you age slower, so I'm thankful I had that when I was younger. And so that's also something to be mindful of. Now, if you ever feel like any of these products are breaking you out or your skin gets worse between now and then, we can adjust your home care. Does that sound okay? Okay, for your evening, you're going to use the same cleanser, the Alpha Beta cleanser. And then I want you to ice your face for 2 minutes. So you can take an ice cube, put it in a little bag, or you can take, we can just tell, we're going to sell them our little, I'm going to show you in the camera here what we have. We have these See that? So these are little cold packs that they can keep in their freezer at home. I really like this over an ice cube. You have like a fabric side, and then we also have like a plastic side. So if it's too cold, the fabric side is really nice, and then this side. And they can clean this and sanitize this. They can rinse it underwater, let it air dry, and then throw it back in the freezer. So if they have two, you know, that's really handy. Or you can stick an ice cube in. So what the ice is going to do is it's going to help reduce your inflammation. So do you get much inflamed breakouts on the left side of your face? Or your forehead?
I'd say around here.
Okay.
Like on my cheeks.
So she does get them on both sides. I can see she has one, a breakout on her chin. She had a couple inflamed breakouts on her forehead, but she's got very mild acne. So what I want you to do is you're going to ice your face for 2 minutes, and you're just going to rub it all around, keep your face cold. We want to reduce inflammation in the skin. If you have a blue LED light at home, you can use that at home as well. 10-15 minutes a day. You can use it daily. You can use it 3 times a week. I know sometimes we get really busy, so that can be something you do at home as well. And then after you ice your face, I'm going to have you apply our benzoyl peroxide on. You're going to leave it on for 15 minutes, and then you're going to wash it off for 3 days. Then the next 3 days, you're going to apply it for 30 minutes, wash it off, and then you'll apply your night moisturizer after that. And then the next 3 days, you'll apply it for 60 minutes, wash it off, apply your moisturizer. I'll have this all written down on a piece of paper, by the way, for you to take home. I know it's very confusing. But what we're doing, and then you'll have it on for 2 hours, rinse it, and then moisturize. And then after that, normally would have you wear it all night long. I don't think you necessarily need that, but I will see you in 2 weeks and we will adjust you at that point. The benzoyl peroxide is going to start drying out your skin. By washing it off and using a moisturizer afterwards, one, it's going to reduce massive inflammation on the skin, possible reactions, and it's going to allow your skin just to adjust to it because it's a very strong product that's going to dry out your skin.
What percentage? Probably
5.
Yeah, and it's got the sulfur in it, which might be.
Yeah. Yeah. So I think sulfur helps with some people. It doesn't help with everybody. Like sulfur didn't do anything for me when I had acne. It was like, eh. And in fact, our formulator may be getting rid of the sulfur. So yeah. So she could actually maybe even handle the 2.5%, a 2.5% benzoyl peroxide product, or a 5%. You do not need a 10% at all. Even the 2.5 might be okay for her skin. Now, I do want you to apply it everywhere because it'll help with the non-inflamed acne as well. So she's going home with a cleanser that has glycolic and salicylic acid. So she's getting gentle exfoliation on the surface and inside of her pores. And then we're going to be treating the bacteria that's inside the inflamed acne and the non-inflamed acne because there is bacteria in there too. And it's going to oxygenate inside those pores. Now, when it comes to benzoyl peroxide, it's a product I don't want you on for the rest of your life. You know, we just want to control your acne. And it may get to the point where, because your acne is so mild, that after 2 weeks, you may be almost completely clear, which is telling me you don't need to wear it all night long. I don't know until I see you in 2 weeks. When we see you in 2 weeks, we'll do another adjustment on your skincare and see how you feel about everything. I am doing a consultation for today and what I think is going to be best for your skin for the next 2 weeks. Get your clients back in the door. And that is how I can help you be your skincare coach, essentially. Leah, do you have any questions for me?
No, not really.
Okay, don't worry. We're going to go answer more questions because they're going to come up because we're going to send you home with some products and we're going to talk about them again. We're going to repeat. I'm also going to tell her that I am available by email, text, call, if there's anything wrong with your skin. Benzoyl peroxide can be, some people can be allergic to it. If you get burning with any products, please call me immediately. We'll figure out what it is. You may already know what it is, but if you don't, definitely call me. Call me no matter what. If anything burns on your skin, we don't want that to happen. We want your skin to be calm and comfortable, especially over the next couple weeks. So as far as an evening moisturizer, we didn't discuss that. I am thinking something gel-based. She still needs some hydration. She's gonna get hydration in the morning from the vitamin C and the sunscreen. Both of those have small amounts of oil in them. So the evening time, we're gonna kind of dry out her skin a little bit. We're gonna try to balance it. I think, maybe the peptide gel has a little jojoba in it. She might actually be okay with something with a little bit more oil in it. I don't know. But I think we're going to start with something gel-based.
I've even used, and this might not be good, but I've used the Hydro Boost at night when I ran out of my moisturizer, and it worked like lovely. Like, didn't break out. It was very moisturizing.
If that's the sunscreen.
Yeah.
Yeah, so she's wearing sunscreen at night.
I did like one night.
Girl, you gotta watch out. Well, hey, in the summertime,
Yeah.
okay, we do have a lot of options for moisturizers. And I would say, as an esthetician, moisturizers are the hardest things for me to get right for a client. I'm not gonna lie. It is really challenging to balance somebody's skin out. She could use a water-based hyaluronic acid serum at night. I think she needs more than that at night. I really do. We have a ceramide cream, which a lot of people who have dry skin and acne respond really well to. So that could be an option that we send you home with. I have like acne papers that I fill out, that I have choices of which product I want to use, so that helps as well. But like I said, she's not really going to be an acne client. An acne client we're going to see every 2 weeks for about 12 to 16 weeks, and oftentimes longer, especially for the tricky people. I think with her, let's see her in 2 weeks, see how she responds. I'd probably want to see you at least one other time after that, because I feel like with her skin, she can either leave benzoyl peroxide on like once a night, a couple times a week, or here's the thing. I don't want somebody to wear benzoyl peroxide and wash it off every night, like forever. It's a lot of work. So I want to keep her life simple. But she may need to continue to use it. How long have you had your cystic breakouts for?
They're like on and off forever, like since I was 12.
Okay. So this is something that she's been battling with, so she may need to be on it for a while. And just figuring out how often she needs to do it. It's called like dosing, like how much are we going to dose her benzoyl peroxide? I'd rather underdose to start versus overdose. we don't want to overdose on anything, right? That's a really good way of saying it. I've never said that, by the way. So just, figuring it out. It's a mystery, solving people's skincare problems. And seeing your clients on a regular basis is going to teach you so much and allow you to make those adjustments. And there's 3 different cleansers I could have picked. There's 4 different moisturizers I can pick. There's 3 different benzoyl peroxides I can pick. I'd rather start people off slower and then slowly build up with aggressiveness depending on how they respond. Some people respond super fast. Now, the vitamin C that I have used on inflamed acne, and it's amazing for it. Ella is on it right now, and you have seen tremendous results. Are you breaking out much?
Not really. I mean, not inflamed a little bit, but like
it's super
like
subtle.
Normal amounts, like nothing like before. Yeah, and especially my inflamed acne that you would think would be mad, because of the oil, but well.
So this brings me up to a really good point. I've recently been seeing people trying our vitamin C, and I've done it with some people. You're on it right now. And I've talked to a couple other people in some Facebook groups about vitamin C on inflamed acne. And traditionally we're told not to do it. But I'm seeing amazing results on people. She's getting results. Leah will report back. We don't know. So what you learn may not always work for everybody, like what we're taught in school or what we're taught in a supplier class. A lot of people have like insurance things that they can't say certain things. They can't tell you, yes, do that, or you're pushing the envelope with somebody's skin. Vitamin C is extremely healing. It heals wounds. I put it on burns. I give it, you know, my hairdresser burnt her arm really bad once during COVID, and I'm like, hey, I want to see you. I just want to hug somebody. Screw COVID. And I went over to her house and I brought her a bottle of vitamin C and we hugged, and I was like, oh my gosh, it's so great to see you. She'd burned herself with her curling iron, and I'm like, just try this and let me know. And she's like, oh my gosh, like the next day my arm is blistering. I'm like, okay. I'm like, oh shoot, I screwed up her arm. Well, then a week later, she's like, Liz, my scarring is gone. I'm like, what? She's like, yeah, I kept using it.
Wow.
And it worked wonderful.
That's crazy. I still have curling iron scars.
Yeah.
They're hard to get rid of.
Put some vitamin C on it.
Yeah, I should.
So,
I'm
old
going to take a
scars?
picture tonight
Yeah.
of my hand and we'll document.
So she has an old scar. Put some vitamin C on it.
Yeah.
Put some red light on it too.
Oh yeah. I'll get my mask.
So literally, yeah, put your red light LED on it. It can reduce your scarring, possibly. You don't know till you try it. So with vitamin C, I'm anxious to see and excited to see her results. So that's going to conclude our consultation for today. And I hope you guys enjoyed this video. Thank you, ladies, for being a part of it. And we're going to get Leah some products that she can go home with. And that was a very long consultation, wasn't it?
Yes.
Yeah. So usually at this whole time, like I'm doing a facial at this time. Okay. So, but once we're in here, you know, I'm doing extractions. I'm already doing that stuff for her. So like she booked like a deep pore cleansing facial. So at the time I'm doing all the talking, I'm also doing extractions. I don't know how many questions I asked, but it was a lot. Was that a lot of questions, Leah?
Not really, no.
No. She's like, no. It was a lot of talking, but I hope everybody learned something. Leave me a comment below. This is on YouTube. And let me know what you think. I hope you guys enjoyed this. I hope you ladies enjoyed this consultation as well. And that's it for now. Peace out.